everyone, it's Alex here from Aleks Physio. Today we're going to be talking about something called golfer's elbow that I sometimes see in the clinic. So golfer's elbow, aka medial epicondylation, is basically a term for medial-sided elbow pain that involves some of the muscles that attach on the structure called your medial epicondyle, and it's this bony bump on the inside of your elbow. So basically, there's a bunch of muscles that attach there, primarily your flexors. So the muscles that are responsible for flexing your wrist downwards, they attach kind of in that medial epicondyle area. And for a lot of people, again, that involve a lot of repetitive bending and extending the wrist, they can have some of this inner elbow pain. It can also be a bunch of other different things, but for the purposes of this video, we'll just talk about if it was diagnosed as medial epicondylation. So today I'm just going to show you 3 exercises that you can do to try to work on minimizing some of the symptoms if you or somebody that you know has golfer's elbow. So one exercise is going to be just to stretch some of those flexor muscles, and the way that you're going to do that is you're going to have your palm, you're going to start with your palm up and your elbow straight, and then you're just going to grab your fingers with your other hand, and you're just going to pull your fingers towards you, and you're going to try to hold that. And when you pull your fingers towards you and you try to hold, you should feel a nice stretch kind of at the top of your forearm. I just want you to try to hold for 20 to 30 seconds. There are a lot of nerves that run here as well, so pulling on your fingers too much, sometimes it might result in some tension in the nerves, so just be mindful of that when you're doing this exercise. You should feel slight discomfort. Hold for 20 to 30 seconds, and relax. Okay. Next one you're going to do is an isometric exercise. So again, isometric is you're generating tension in the muscle without actually going through a range of motion. So if you want to activate the flexors, so the muscles at the top of the forearm, what you're going to do is you're going to take your other hand, and your left, in this case your left hand, is going to be pushing up to try to extend your elbow, and then your right arm is trying to push down, and try to bend your wrist, not your elbow, your wrist. Okay, and then you're just going to try to hold that. Again, you should feel the muscles here swell up when you do this movement. And I want you to try to hold that for maybe 15 seconds and see how that feels, if that provides any relief. And then the third exercise is you're going to take the theraband again, and you're going to do some resisted wrist flexion. Okay, so what you're going to do with this is your top hand is going to provide the resistance upwards, and you're just trying to push down and try to flex your wrist as the other hand is applying that resistance. Okay? And you're only trying to move at your wrist. Okay? Give those 3 exercises a go. Let me know how they go. Thanks for watching. Please like, comment, and subscribe if you find this information useful, or if you know somebody that has a golfer's elbow, please let them know about it. Obviously, tell them to go to a physiotherapist so they can give you a more specific program and some other specific exercise, and also there's some hands-on mobilizations that you can perform to help to alleviate some of the symptoms associated with it. But nonetheless, give these ones a go and let me know how they go. Thanks so much.